a research or a new research that indicates that 46 mutations have been found, and this is in COVID-19 Omicron variant, just one variant with like 46 mutations. And of course, Alpha has 23 mutations. And remember, like we said, we also have like different other variants. So the big question is, should we be concerned as a people? And before we respond to that, we have Marceline Odhiambo, who is on Zoom. And Marceline is like, well, you know what, me, I'm not too sure if I want to get vaccinated, because she was like, there's no guarantee that this vaccine will protect me. But Marceline, I just want to understand, where is that, anxiety stemming from? Is it based on the stories that you've had, or where does that stem from?
I mean, you heard of people having complications because of vaccine. When I wouldn't say that I'm part of some anti-vaccine organization or society, I don't want to form part of any revolution, but I just feel if you can actually take care of yourself, like I was saying, everyone is at risk. I agree, but still, why are you getting this vaccination? And then with every mutation, we have boosters. There's the first dose, and then there's the second one, and then there's the boosters. I mean, I'm wondering, where does it all end? I mean, some of us are losing confidence in that vaccine, and I really don't know how the doctors are doing it, but I think everyone has a chance to actually decide if it's actually going to work for them or not. Because the doctor was talking about if you feel like you're not immunocompromised to something. But I believe that if you're not, okay, anybody can be a risk to someone, but still we have that chance to decide for ourselves, do you want to get vaccinated? Okay, if no, then okay, all right, it's fine. Take care of yourself and others.
All right. So Marceline brings up two important questions. The one question is, number one, we do not know, first of all, where did you get these vaccines? And a lot of people are asking, it took a very short period of time to come up with the vaccine. So how safe is it? And then the second question is that aspect of then balancing between human rights and making sure that everybody is safe and that is taking the vaccine. But then again, if someone is like, me, I do not want to take these vaccines, I'll take care of myself, I'll protect myself. Why do you have to force me? Which Dr. Kwale, you'll address that. But for now, Professor Julius, listening to what Marceline, and these are very valid concerns, that so many people have, including Marceline herself, who's like, these vaccines, first of all, mulito haraka sana. And then number two, it's like, we do not know anything about these vaccines that guarantees that we'll be safe, so just understanding the whole aspect of vaccine, why is it important, and why do we need booster shots?
Okay, that's a good question. So number one, where did this vaccine come from? And why did it take such a short time to develop vaccines? Number one, we have been having outbreak of diseases globally before. I remember in 2014, there was Ebola outbreak in West Africa. And during outbreaks that lead to deaths of a number of people, scientists normally come together to start developing tools, either in form of vaccine or in form of treatment. So these tools, once they are developed, they act as a bank. Next time there's a pandemic, they look at the tools that are already existing and whether they can use them to develop vaccines. Okay. So the vaccine that we are using today is using what we call mRNA technology. This technology was not developed during COVID. When COVID came, it had been developed before. But now, when COVID came, is when now they actually experimented to see if it works. And it actually worked. That is number one. So the mRNA itself is very safe. When it gets into your body, it will make parts of COVID virus, which is not the entire virus, only the parts of the virus that only train your body to produce protection, right? And then it dies. So there's no risk at all of mRNA vaccines. That's number one. Number two, how did we develop this vaccine so fast? So I've told you that we developed technology and we bank them, right? Time, yeah. So already the technology was already there. That is one. But again, if you look at the global, as we speak now, we are developing technologically. Previously, and you heard this a lot last in 2020, when people were developing vaccines, people were saying that the minimum number of time that you need to develop vaccine is 1 year. But that was before. Now we have the ability to develop a vaccine and test it within less than 1 year. Right. And this was done. And for a vaccine to be used in human beings, by the way, it has to go through very rigorous testing in humans. Number one, to look for how safe is this vaccine in humans. That is very key. So a vaccine cannot be approved for use in humans unless it is safe. It has been established that it is safe for humans. The second thing they look for is this vaccine going to provide you with the protection required against the disease that is now circulating? That is number two. Now, if those two things have been approved through a thorough study, then the vaccine is approved. And there's one body that approves vaccine globally. The current vaccines that we are using were initially given emergency approval because of pandemic. But they've actually shown that these vaccines, once you are vaccinated, although they may not protect you from getting infection, but they protect you from getting serious COVID disease.
Okay.
So I think the viewers should be, number one, they should remove the notion that the vaccine are not safe. There is no evidence whatsoever that has shown that majority of people who have been vaccinated have died due to vaccination. When you go for vaccination, by the way, you may feel pain, you may feel body weaknesses, but we call them vaccine reaction, which actually disappear within less than a day. After that, you are okay and you are protected for some period of time.
Yeah.
So I think our viewers should not be, should not stick to this myth that vaccines are not safe. I can't go vaccine because they were developed within a short time. Me, as a virologist, I've been vaccinated, right? So if I know how vaccines are made, I know whether the risk about vaccine and have been vaccinated. How about you, right, as a viewer?
Yeah.
So I would encourage our viewers to go and get vaccinated. The third thing, and as I said earlier, when new variants come, now you see like Omicron, we are talking of a booster, right? But if you look globally, when Omicron came, the number of people who were ending up in the hospitals were the unvaccinated. Yeah. Majority of them were the unvaccinated. Yes. Okay. So do you want to be in that group of people when a new variant comes, you want to end up in the hospital or die? I would rather be vaccinated. Now, if a new variant comes, I will be partially protected against that new variant.
Yeah, but now the question is, how many boosters do we need to make sure that we are protected? I mean, will it get to a point? There's a meme that is on Twitter. I think we'll have it up in a moment, where this person said by 2030, fully vaccinated, you have like jabs all over, all over until your forehead. So the question is, how many boosters do we need? And you'll answer that in just a moment, Professor Julius. But let's talk to Dr. Kwale. Where again, what Marceline is saying. Listen, I do not want this vaccine, and I think it's a stand for so many people who probably have been categorized as people who are hesitant to getting the vaccine or anti-vaxxers. But then again, where is the problem? If someone says, listen, I do not want to get vaccinated, yes, I'll observe all these protocols. I'll make sure that I am safe. If I do not want to be vaccinated, why do you have to coerce me to get vaccinated? I think we've had this measure by the Ministry of Health that some of these people have been locked out from malls, from accessing public offices. Again, isn't this like, an infringement of a person's right? Because like Health Ministry said, and this is through the CS, that listen, this is voluntary, okay? We are not forcing anyone to get vaccinated, but at the same time, it's like we're forcing you to get vaccinated.
Okay. Yeah, thank you for that question. And what I would want to start by saying is that, we need to know that the coronavirus is a new virus. It's a global pandemic, and there's still a lot to learn from it. And we need to appreciate that it is at the point where we may drop our guard, is at the point we may feel like these things are not working, that we may be hit hard. We need to learn from the Spanish flu. When the second wave came, that's when most people died and they had dropped the guard. And we saw something in India last year when people was just complacent, and this is very fresh, less than a year ago. So one of the things we need, I want to reiterate here that COVID-19 vaccination remains voluntary in this country. And what we are doing as government is to ensure that we give information so that people are vaccinated for first their own benefit. But it's also important to realize the government has to put in regulations to protect others. When you talk about human rights, a line needs to be drawn because there will be groups that need protection. You see, we need, like, if we came to this studio and, yes, Prof has said is fully vaccinated and boosted, even you will feel comfortable in this enclosed environment among people fully vaccinated, because science has also shown us that the vaccinated people shed fewer viruses than the unvaccinated. I believe you'll be very uncomfortable to have 6 panelists here with no vaccination at all. You'll be at risk yourself. So then the public health measures start coming in, and this is to ensure that the rights of both those who don't want to be vaccinated and those who are fully complied, we start getting a balance to protect each other. And then secondly also, there's something on the issue of herd immunity or population protection, in which you see the more people that are vaccinated, the less the transmission of an infectious pathogen within the community. So, you know, we have the up to 15-year-old who are not getting vaccinated, but we need to protect them. So it requires then we have as many people so that we protect those under 15. So what is the right of those 0 to 15 years? They are newborns who may be, whom we know can be protected by reducing transmission at community level. So mine is to really say, yes, you may have your right, but you must also consider the others also have their rights. And where government comes in is to be in the middle and ensure regulations protect both.